Folks, good day. My name is Howard Preston. I've been working in the field of highway safety for right around 50 years, and have worked on highway safety at the state, county, city, and tribal levels at states around the country. It's my pleasure to share with you today the history and the background and the ideas that are contained in the Big Book of Ideas. This is the first of 3 videos. We'll talk first about the history of the Big Book of Ideas and how it came to be, and then there'll be separate videos that talk about and discuss rural strategies and then urban strategies. The history of the Big Book came out of the Big Book of Ideas came out of the partnership that MnDOT had with the counties that generated the county road safety plans. This partnership, MnDOT brought technical assistance and financial assistance to the counties. Counties provided the staff to review the technical analysis, to review suggestions, and then to do the really hard work, which was the implementation of safety projects. Having a plan and having an idea doesn't result in the reduction in crashes. It's the implementation that comes out of that. And a little while down the road here, we'll share with you what kind of numbers were generated as far as safety projects being implemented by the counties. And it was quite impressive. So I mentioned MnDOT brought technical assistance. The first part of that was conducting the systemic risk analysis of the entire county system. And that was 22,000 miles of paved county roads. And I just want to mention the paved roads were selected because the analysis of the county system showed that over 94% of severe crashes occurred on the paved roads, and that the paved roads had a crash density, severe crashes per mile, that was 10 times higher than on the gravel roads. So the paved roads were selected for analysis, along with 19,000 horizontal curves. And it'll become obvious why curves were selected when we talk about that a little more as part of the strategies. And then also 13,000 intersections. So this was a comprehensive safety analysis across the entire county system, across all 87. Similar to bringing the technical assistance with the crash analysis, when it came time to developing safety projects, which is the suggested deployment of a specific strategy at a specific location, we looked at what were the sources of safety strategies. And at the time in the early 2000s, the most comprehensive source of safety strategies was something called the NCHRP, National Cooperative Highway Research Program, Report 500. And it was a compendium of 24 volumes of suggested strategies for things such as road departure crashes, intersection crashes, pedestrian crashes, head-on crashes, and even behavioral related crashes. And across these 24 volumes, something on the order of 600 strategies. And so we thought at the time, similar to not asking the counties to do their own safety analysis because they wouldn't have been familiar with it. It would have been unreasonable to walk into a county highway department, throw 24 volumes of a document down on somebody's desk and say, why don't you search through these, because somewhere in here is going to be a strategy that you're going to like. So instead of doing that, the project team working on the county road safety plans went through the 24 volumes, and based on things such as effectiveness and cost and being familiar to the safety culture here in Minnesota, we selected about 35 or 36 safety strategies and included those in something we called the Big Book of Ideas. One of the key things I mentioned was this notion of effectiveness, and the idea being At the time, it was new to the NCHRP 500 series. Categorizing effectiveness as proven, tried, and experimental. And we tried to focus on proven strategies because the notion then is for any of the county engineers who wanted to deploy a strategy, which most likely would have been brand new to them and brand new to their county boards, we could share with them if they chose things that were considered to be proven effective, such as edgeline rumbles or roundabouts or shoulder rumble strips, those kinds of things. They would have then the highest level of confidence that the crash reductions that were cited in the Big Book of Idea, uh, they could expect to see the same kind of crash reductions and give them that kind of confidence going forward with their deployment. So the purpose again of sharing with local road authorities now information from this Big Book of Ideas, it's really twofold. First, to reconfirm for the counties, local road authorities, that we still have confidence in these strategies as being effective at addressing the kinds of crashes that have been identified as being overrepresented on their system. And second, provide some food for thought, ideas about possible future safety projects on local system using strategies that both MnDOT and Federal Highway would likely support with financial assistance through the Highway Safety Improvement Program. So the way to use the Big Book of Ideas, it's divided up into rural and urban strategies, rural segments, curves and intersections, urban segments and intersections, interchange types. Again, the key information that's provided, an estimate of the cost, because there is still a focus on lower cost kinds of strategies. The local system is just so large and so many potential places that could be identified as priorities for investment. There's just not enough money in the safety program to widely deploy high cost kinds of strategies. And with the systemic risk assessment, again, the idea is that we could be identifying places that have no or few crashes as being at risk. And there's lots of those places. And so a key approach to improving safety is to widely deploy, touch as many places that are at risk as you can with the available funding. And the only way to do that is with low cost kinds of strategies. And then also, again, we're focused on the crash reductions to provide local engineers with this high level of confidence that what they're deploying has proven to be effective elsewhere, and they can have a high level of confidence that they will see the same kinds of crash reductions. So we focus again on effectiveness, and I'll just share that most of these strategies are effective in the range of 25 to 30%, and we consider that to be highly effective. And a question may be, why not something in the 70, 80, 90% range? There's very few of those. We'll talk about a couple of them today. Roundabouts and J-turns come to mind, but just a point to consider is that according to, it's a National Highway Traffic Safety Administration, driver error is a contributing factor in well over 90% of crashes. Behaviors like speeding, alcohol use, not using seat belts, distraction, those kinds of things have an effect. And the effect is to say, for example, if somebody is so impaired that driving down the road, they can't sense that they're running over an edgeline rumble, you're not going to, the edgeline rumble can't be effective in those kinds of conditions where the drivers are either so impaired or so distracted, or if they don't have a seatbelt on and manage to get over the rumble, and then bad things can happen. So the notion is, again, we're not blaming drivers. We're just saying that there is an awful lot of these severe crashes that are occurring where driver error is in fact a contributing factor, and that then gets us to places for things that we consider to be strategies to be highly effective in the 25 or 30% range. Through the presentation, you'll see crash reductions identified with 1-star, 2, 1-star, the crash reductions based on national studies, 2 Minnesota-specific studies. It's been shared with us that some local agencies put a higher level of confidence in Minnesota specific because it's here, it's our geography, it's our drivers, and so we've identified which studies are national as opposed to which studies come from Minnesota specific research. So folks, this wraps up the history portion of the video. We will follow up with discussions of rural strategies and then urban strategies.